Dr. Brony.
Thank you, Becky. As Becky stated, my name is Dr. John Baronio, and I am part of Valley Medical Group. I have been a part of Valley Medical Group since April of 2017. And my main office is 80 Route 4 East in Paramus, but we also go to the office in Wayne, which is on Route 23. And we are just starting to go as of next month to the new Valley facility in Montvale. So if anyone needs to be seen up in that area, Montvale will be open starting January 5th. And that we started today. And tonight I am going to talk about the ways of keeping your feet healthy, mostly concentrating on common skin and nail problems that you'll see on a daily basis. So first, we will start with the most common nail problems that come across my desk, my office, and I'm sure problems that you have seen in well. The most common nail problem that we will see is called a toenail fungus, or the technical term is onychomycosis. And that is when your nail becomes real thick. It'll become brittle. It'll become kind of a yellowish brown color and very difficult to cut as well. And here is a good picture of, you'll see these little white lines and the brittleness and the red, and the yellow brown look to the nail itself. Causes of onychomycosis or fungal nail infections. Usually it's warmth, moisture, and darkness, which, if you look in your shoes and socks, that's what your feet are in every day on a daily basis. That moisture that you will get when your feet sweat, sitting in the sock and shoes for 8 to 10 hours a day, is a perfect breeding ground for a fungus. And that's how a fungus likes to live. The other cause of it is age and poor circulation due to diabetes. Most people, you'll see as you get older, your nails will start to change. And that's because your feet, being that they are the furthest from your heart, the circulation down to your feet isn't what it once was, and it's harder to fight any type of fungal infection off due to the poor circulation. You can also get a nail fungus from a skin fungus, which is what's called athlete's foot. Fungus doesn't discriminate. It goes wherever it can go. So if you have an athlete's foot, which we'll go over in a little bit, then it's possible and common that the nail will then become infected as well. And it is much easier to treat a skin fungus than a nail fungus. And we'll go over those as well. And the last and least type of way to get the nail fungus is trauma. And trauma could be anything. Trauma could be dropping something on your foot. Trauma could be an ill-fitting shoe. Trauma could be someone stepping on your feet. And that's a way for the nail to become compromised, and a fungus can pop up with it. But again, you have to have that warmth, the moisture, and the darkness to really have that fungus grow and multiply and really become hard to treat. So speaking of treatments, there are two different types of treatments. One is topical and one is oral. And obviously the oral is an oral pill. Topical medications, the pros for the topical medications is obviously it's not oral and it's easily applied. And it's something that you would do on a daily basis. The cons to the topical treatments is that they're not as effective, and it takes a long time for it to work. Now, I do believe that the newer topical prescription antifungals, they do work, and they do work well. However, the way these work is you have to put the medication on a daily basis for months at a time. The medications that you're using really don't kill the fungus that's in the nail, but it protects the new nail from when it as it's coming in. So if you were to look at your big toenail from the base of the nail, or the matrix where the nail grows from, the time it takes from the matrix to the tip of the nail is about a year. So you're talking about having to put on medication for a good 6 to 8 months before you really start to see an effect. And human nature is, if you start doing something for 2, 3 months and you don't see a result, well, that daily application starts to become every other day. And that every other day application starts to become every third day. So that's why the topical antifungals are not as effective as the oral medication. Now, the oral antifungal, it's called terbinafine or Lamisil. The pros with that is, A, it is more effective. You take this medication, 1 pill a day for 3 months. So it's an easy way to take it. And 3 months, boom, you're done, and that's it. There are certain side effects, and these are the cons to the oral medication. One is the liver. The oral medication can interact and affect your liver enzymes. And the way we would combat that is, prior to starting the medication, you take a baseline liver function test. And you're on the medication for 12 weeks. So at 6 weeks, after taking the medication for 6 weeks, you get a second liver function test. And if anything changes, if there are any precipitous changes to the lab work, then you stop the medication and you're okay. And one of the other main side effects is it can affect your taste. So if anybody had COVID back in the day, 5 years ago, 6 years ago now, where your taste was affected, that happened with me, where I lost my taste for a good 12 months. That's one of the other main side effect that I have seen. I've seen that 2 to 3 times in the years that I have been prescribing this medication. And the other problem with the oral medication is that it can interact with other medications, mainly the statins. So if you're on a statin for your cholesterol, you're not going to be taking the oral Lamisil. Second most common problem that I see in my office is an ingrown toenail. Now, on this picture here on the bottom, you'll see the healthy nail on the left and then the ingrown toenail on the right. An ingrown toenail is when the corner of the nail starts to dig into the skin, and it breaks through the skin into the skin on the side of the nail. Now, normally, and very normally, there's bacteria on the surface of the skin, and that's one of the functions of the skin, is to protect itself with certain bacteria. And once the skin is punctured, that bacteria that's on the surface of the skin can then get into the soft tissue, and that's when you become infected. And if you can see the sides of the nail here, how it's kind of bright red, pinkish red, and you see on the right-hand side of this nail here, if I were to squeeze that, it would cause a lot of pain, and that's what an ingrown toenail is. Causes of the ingrown toenail. Most of the time, it's self-inflicted. It's a self-inflicted wound because people don't cut their nails properly. And what I mean by properly is you cut the nail straight across, and then what that will do is that'll leave a sharp edge on either side of the nail, which you then just file. You file that to kind of round off with a file. But what a lot of people end up doing, and I've been guilty of it myself, is you dig into the corner, because you do have that little piece in there. You kind of cut into the corner, and as you do that, it does start to hurt, and you stop. Once it starts to hurt, you stop, and you just pull that piece out and you go on with your day. But when you do that, most likely you're going to leave a little piece of the nail inside there, and then as the nail grows, that piece is what ends up going into the skin, excuse me. And when I do remove those, it'll look like a little tooth. You'll see a little spike that at the end of the nail, you can see right where the nail clipper had stopped and just missed that last little piece. Another cause of ingrown toenails are ill-fitting shoes that are too tight. That causes a sideward pressure up against the big toe. Usually it's the big toenail. It causes that sideward pressure up against the toenail. And then as the nail grows, it just grows into the skin. And I'll see this a lot with hockey players. I'll see it a lot with ice skaters who have to really squeeze their feet into their shoes or their skates. And that's what causes the ingrown toenail. And then least common is when you have a bone spur on the tip of the toe. And I'll show you that with an x-ray. And what that does is it causes the nail to grow instead of flat, it grows to the sides of on the toe. So how do we treat the ingrown toenails? Well, if you have something like this, where it's real red and painful at the base of the nail, that would require some anesthesia. And what I mean by anesthesia is just a local anesthetic where you give a little lidocaine, just like the dentist. You numb the toe up, you cut the nail out, and then that's it. The other way you can do it, if it's not as infected, it's not as painful, what I do is I will just freeze the skin and clip the corner of the nail, make sure I get the whole thing. And then you dress it with a Band-Aid and Neosporin, and you're good. Another way to treat these ingrown toenails if they become chronic, and when I mean chronic, if the same nail becomes ingrown 2-3 times and it becomes infected each time, then what you do is you do a permanent removal, and that is done with a chemical where you cauterize the nail matrix. And it's basically the same as doing it under anesthesia, because you do have to numb the toe, you anesthetize the toe, you cut the nail all the way down to where it starts, and then you put a chemical in the corner, which then burns the matrix. The matrix is where the nail grows from, so just that corner of the nail is destroyed, and you'd be left with a straight edge on that side of the nail and no more ingrown toenails. And then obviously if there's a bone spur on the toe, you have to remove that bone spur, and that will then allow the toenail to lay flat. So again, here's how we cut the nail. On the left-hand side where it says right, that is nice and straight across. And in the middle is where the sides were dug into the corner. And the last picture is where you see that ingrown toenail. And this on the right-hand side, this last picture is the after effect, or what the nail looks like after it was cut. On this one, the doctor was pretty aggressive. He took a large part of that nail off. I don't usually take that much of the nail off. So when I mentioned that bone spur before, what you're looking at on that x-ray is a side view of the big toe. And the top of the toenail, or the top of the nail, that should be all flat. And you can see how it looks like there's a thumbs up on the tip of that toe. That is a bone spur. And what that will cause, and that spur is the whole width of the toe. It's not just on one corner. So that causes, it sticks up in the middle of the nail, or in the middle of the toe, and that causes the nail to grow into the sides. It will not, see how on the right-hand picture, the big toenail, how that's not laying flat like the second toenail. And that's due to that bone spur. So what has to be done with that is that bone spur then gets shaved off so the toenail can lay flat. The next is what's called a subungual hematoma. And if anybody has ever dropped anything on their toe, if you've dropped, a weight, a can of corn, any bottle of soda, and you get that big black underneath your toenail, that's just blood that's underneath your toenail. That causes a great deal of pressure and causes a great deal of pain. And the way to treat that, and the way to treat the subungual hematoma, if anyone's ever, put a needle into a flame to sterilize it and stuck a hole in their toenail, that's the way to do it. I mean, you either can put a hole in the toenail, or usually there's like a little pocket right underneath the toenail where I can make a small incision and drain that fluid, drain that blood out from underneath the nail, and that does provide immediate relief from the from the subungual hematoma. Any questions so far?
We do have a question in the. Oh no, just a hello. Let's. Oh, wait. Okay. Don't mess with the liver. Scary. I don't know what. I'm sorry. I don't know that is affected the taste. Wow. Does vapor rub protect the healthy nail from fungus?
Vicks Vapor Rub.
Mm-hmm.
It doesn't protect the nail coming in, but it's an old wives' tale that it does help get rid of fungus, and I've had patients that swear by it.
And there was
So
also, they also said they also use Listerine to kill athlete's foot.
Listerine, that I have not heard yet.
Hmm.
That I have not heard.
Another question just came in was how long approximately does it take the sub
Ungle.
ungle, thank you, hematoma to heal?
Well, once you get the blood out from underneath the nail, it just takes a couple of days for that for it to heal up. And like I said, you get immediate relief from that.
Mm-hmm. Okay.
Sometimes though, with a really deep or a large subungual hematoma that takes up 90 to 100% of the nail, you may end up losing the nail eventually, because the once that nail is separated from the skin, it is a good possibility that you end up losing the nail.
Okay, we had another one coming. Can the hematoma lead or be mistaken for a melanoma?
No, it can, they both can look the same. Okay, but with a hematoma, you are going to have trauma. I mean, if something looks like a hematoma and there's no history of trauma, then you start to think of something else. And the hematoma, you're going to evacuate. You're going to, put a needle in there, make an incision to get rid of that fluid. And then, so if you try to do that and no fluid comes out, well, then you got to think that it's not a hematoma.
Okay, if you have an elevated nail apparently caused by a bone spur, is surgery the only option?
If the nail is bothersome, yes, because we can remove the nail. I mean, that's fine. We can do that, but once that new nail starts to grow in, that bone spur is not going away. So you're going to end up with the same type of condition.
Hmm. And
And
what
the
is
surgery itself is a pretty innocuous procedure. It's done right in the office, where the toe is anesthetized with lidocaine, and just a small little stab incision is made, and use a machine to just grind that down. And it's one stitch and a band-aid over it, and that's it.
great? What is the chemical used permanently to permanently kill a nail matrix ingrown toenail? Can it chemically burn the skin around the nail?
The chemical is called phenol, and it's an 89% phenol. It is a very powerful acid, and yes, it can burn the skin, but it's applied very carefully with a cotton tip applicator. That is really just a stick with a small little amount of cotton on it. So care is taken not to touch the skin.
And what is the second pill that I could try other than Lamisil to stop the toe fungus?
There's also a pill called Sporanox, and that's more of it's a dose. It's not as effective as the Lamisil, and there's also griseofulvin, but that is really more for a skin fungus than any type of nail fungus. It doesn't penetrate the nail as well as a Lamisil does.
Okay, those are all the questions we've had so far. I don't see anyone asking right now, but that's what we have.
Okay, moving on. Go into what everyone's starting to get to now. They're cracked heels. And if you've ever had a really deep cracked heel, you know just how painful these things can be. Um, you look down at your heels, you see like little cracks, like you'll see in the earth when there's a big drought. And if you look in the desert, you'll see the cracks in the skin, and the same thing with the heel. The causes of cracked skin, as you can see, are dryness, excessive heat, prolonged standing. There's, I've had a lot of people, these last few weeks as we prepare for Christmas that are workers in stores like Lowe's or Home Depot that are standing on their feet for 8 to 10 hours. They come in and they have really, really bad cracked heels. Um, diabetes can affect the moisturizing of your skin. So it would cause dry skin, which will cause these heels to crack. Other causes are psoriasis, eczema, and hypothyroidism. So how do we treat the cracked heels other than going for a nice pedicure? It's really soaking, exfoliating, and when you exfoliate at home, you want to use either a file or a pumice stone. You want to regularly moisturize your feet using a cream with either urea or lactic acid. I have no financial interest in anything, but the cream that I recommend mostly is called CeraVe cream, CRAVE cream. It's an over the counter. It can be purchased anywhere. CVS, Walgreens, any supermarket. Everybody has them now. And also you want to wear proper footwear. Proper footwear where you're that's not too tight. You want to avoid like boots or shoes that are very restrictive and don't allow your feet to move within the in the shoe. And as I mentioned before, the fungal infection of the skin is what's called athlete's foot. And with athlete's foot, you will see real drying of the skin. You'll see cracking. You'll get a burning and itching. It'll wake you up. It'll wake you up. It'll keep you up at night. Having to scratch, and then it'll burn. Again, moisture, warmth, and darkness are the three friends of a fungal infection. There's also, you can pick it up in a gym or at a pool, anywhere where you're barefoot in public, or contact with somebody, with a family member or anybody else who may have it at home. Those are the things that you want to avoid. Treatment for athlete's foot. Both you have over-the-counter and oral prescription creams, and the oral medication like we spoke with as griseofulvin. The difference between the over-the-counter and the prescription creams is most of the over-the-counter creams are what are called fungistatic creams. Fungistatic means that it just stops the production or stops the replication of the fungal cells. It doesn't kill them. Whereas the prescription medications, what they do is they're called fungicidal, meaning that they kill the fungus that's there. So when you do put these medications on, what I tell my patients is once you see that it's cleared up, and it usually takes a week to 2 weeks to clear up, you want to keep putting the medication on for another 2-3 days, because if you do leave 1 or 2 fungal cells around, they'll find each other, they'll replicate, those will replicate, and you'll be back to square one before you know it. And once again, the oral medication, like griseofulvin, they're effective, but I don't think as effective as the creams, because the creams can also, what we also do too with the prescription creams is we will add like a hydrocortisone or any type of antipyretic part to that medication to really control the itch. Because, like I said, athlete's foot can really drive you crazy with the itching. And with the itching, one of the problems when you start to scratch is You scratch too hard, you scratch too much, and you break the surface of the skin. And as I said before, that natural bacteria that's on the skin, once the skin is broken, can then push into the soft tissue. So now you're left with not only a fungal infection, but a bacterial infection. So you need the antifungal medication, then you're going to need an antibiotic to take care of that bacterial infection as well. The next condition that we'll go over is something that is very common these last few weeks, and it's called chilblains or pernio. Pernio being spelled Pernio, not like my name, but with a P instead. And that is a condition that you will see, and it's due to the cold and moisture. And you'll see redness, you'll see pain, itching, burning, and you'll see red or purplish bumps. And it's a condition, like I said, due to cold. It's a reaction to the cold where the blood vessels just open up and dilate and constrict and dilate. And it is a very painful condition. It's similar to Raynaud's disease, but it's not Raynaud's. And the key to treating chilblains is to rewarm your feet slowly. You don't want to just run them under scalding hot water real quick. You want to start with a lukewarm water and just gradually raise that temperature up of the water to slowly rewarm your feet. You want to keep your feet moisturized. Moisturizing your feet is key. Avoid scratching because you don't want to scratch too hard and develop that bacterial infection. And keep your feet warm and dry. And another reason, which is avoiding smoking, which you shouldn't be doing anyway, but smoking is a vasoconstrictor, and that'll just really constrict the smaller blood vessels in the feet and the toes. The next skin condition that is common is.
Can
Go
I
ahead.
just,
I'm sorry.
we have quite a few questions coming in, so if you don't
Shoot.
mind. Okay, so what about, I'm gonna have to spell this for you, Cyclopirox,
Cyclopyrox.
Nail lacquer for toe fungus.
I prescribe it almost on a daily basis. It does work well, but again, it's something that has to be done daily and for months at a time.
Okay. Do the prescription athlete's foot creams prevent reoccurrence?
No, because your feet can always become, moist, and you're stuck in shoes and socks. They don't prevent recurrence of it, but they will treat it every time.
I've had a toe fungus for at least 1 year. The last 1 year, I took the meds from the doctor. I still have the fungus. Now, what do I do?
That's a toughie. That's a tough one. If you've taken the medication and it hasn't cleared up, most likely that's going to be what you're left with. Yeah, I mean, you could try if it's all the nails, it's difficult, but you can try removing the nail and then starting to put a topical antifungal on as the new nail grows in. But if the oral medication didn't work, I think that's what you're left with.
My goodness. Okay. Is Aquaphor ointment good for cracked, dry skin?
Yes, it is.
All right. Oh, so somebody was late, but can you please send an email to me about yes, we will send an email out about the recording. And are you taking any new patients?
Absolutely. In all 3 locations.
Okay, great. If the skin is really dry but not cracked, should one use a cream or with a urea, or is that too strong?
No, the urea cream works very well. Use the urea cream.
Well, that was all the questions we've had so far. So we'd love for you to continue with your presentation.
Okay.
Thank you.
So we will go on to what's called plantar warts. If you've ever had warts, you know what I'm talking about. Warts are a viral infection of the skin. And these are called plantar warts because of their location on the foot. The top of your foot is called the dorsal surface of the foot, and the bottom of your foot is called the plantar surface of your foot. So when you hear plantar wart, it just tells you where it is. So these warts you're looking at here, if they were on the top of the foot, it's still the same virus, it's still the same wart. It's just not a plantar wart because it's not on the bottom. But when they are on the bottom, it's a viral infection of the skin, and then as you walk on these, the skin becomes hard, and that's when people start to notice it because they have this. It feels like they're walking on a little pebble. Um, the virus itself is the human papillomavirus, and it's contracted in many different ways. Contact with someone, through an open cut, through just a little crack of the skin, the Y in the various Y's in the area help keep me in business in the winter because that warm, moist pool area is and people are walking barefoot is a common way to pick up these viruses. And as that hard skin accumulates, that's when these warts become real painful. And that's when people start to seek treatment. There are different ways of treating these warts. One, which is the most common way, is serial debridement, meaning you remove the dead skin with a scalpel, and you apply that same type of phenol or a cold spray to the wart in order to kill the virus. And what you're doing, because you have to do it, usually it's biweekly, you're bringing the wart from the deeper surface of the skin up and out, up to the surface, and then get rid of it that way. And then what I like to do as I'm doing the biweekly debridements is have the patients treated at home with a compound W or any type of like a salicylic acid treatment, where you put that on a daily basis, and that helps to draw the virus up and out. And then the last resort is surgical excision, and that just means we numb the area up with an anesthetic and surgically cut the wart out with a scalpel, and then cauterize the area with an electric cautery, in order to burn the skin around it to be sure that all viral cells are destroyed. The problem with the surgical excision is you have to go through the full thickness of the skin, and that can cause scarring in the long term. And scarring on the bottom of your foot over time, that's going to be worse than the wart itself because the scar becomes hard, and it's like having a constant pebble in your shoe, and it becomes very painful. So I try to limit the amount of surgical excisions that we do. If the wart is on top of the foot or on the side of the foot, yeah, then it's easy to go ahead and do. Let's going to move on to that. The last condition we'll go over tonight is plantar fasciitis. And if anybody has ever gone to bed feeling good, having no pain, and then you go to wake up in the morning and you go to stand down and you feel this toothache in your heel, that's what's called plantar fasciitis. And it can come on very suddenly, or it can come on due to some sort of trauma. The symptoms of plantar fasciitis, that morning pain when you first wake up in the morning, those first few steps will hurt. Or if you have a long drive to work, or you're sitting watching TV for a half hour or so, and you go to stand up, you'll get that pain, that toothache pain in your heel. It's a sharp stabbing pain that you'll feel that will start to go away after a few minutes, where you start to loosen it up as you're walking. You will also get pain in the arch because the plantar fascia is it's like an elastic band that will connect your heel to your toes. So you'll feel that pain in the middle of the plantar fascia, which is right in the arch. And again, pain at night at the end of the day, when the plantar fasciitis is settling down and the inflammation is kind of settling, you'll start to have some pain at night. Causes of this is the plantar fascia that you see here, that band of tissue connecting the heel up towards the toes. The main cause of heel pain or the plantar fasciitis is lack of support in your shoes. So I'll see a lot of this in the summer. When people are walking around in flip flops that have no support to them. What happens without a lack of support is that plantar fascia, like I said, it's like an elastic band. So if you don't have support in it, it stretches. And when it stretches, it's going to pull right on that heel bone, right where it starts. And because the bone is living tissue, it becomes inflamed and becomes painful. So when you take your weight off of it for a longer period of time, like you're sitting or sleeping or driving, that stretched out plantar fascia, it contracts. So when you go to step down on it, you're stretching it out again. And that's why you'll feel it when you step down. And then it'll reach a point after a few steps where it can't stretch anymore. And that's when it'll start to feel a little better. But if it's at that stretched out point all day, it becomes real inflamed at the end of the day and becomes painful. So poor shoes, I mean, that kind of goes with the lack of support. And then trauma too. I will actually see a lot of pickleball injuries with this, where it's a lot of stopping, starting, and pivoting, where that plantar fascia, you'll be on the tips of your toes, on the balls of your feet, and it just becomes stretched and becomes painful. Actually, there's the extreme point where you're doing that and you actually tear the plantar fascia. And that is one of the more painful things that people will come in with. That's a very, very painful condition. If anybody's ever followed the NFL, that's what Peyton Manning had in his last year of his career, where he missed like 7-8 games because he had torn that plantar fascia. Treatment for plantar fasciitis: good old RICE, which is rest, ice, compression, elevation. Strapping, where I will apply a taping to the bottom of the foot in order to support that plantar fascia and take away that stretch of it. Custom or over the counter or an orthotic. Again, what that does is it supports the plantar fascia and not allow it to stretch. Physical therapy, and then corticosteroid injections. A steroid injection which will treat the inflammation and get rid of the inflammation, and it gives you pretty immediate relief. But the injection, what it does, it treats the symptom and not the cause of the plantar fasciitis. So what I will do is, I'll give an injection to make someone, really pain-free, but you have to augment that or supplement that with the support, and that's either the custom orthotic or the over-the-counter orthotic. And finally, the last treatment, if everything else fails, then it's called the surgery to correct the plantar fasciitis, is what's called an endoscopic plantar fasciotomy, where a small incision is made on each side of the foot, and that plantar fascia, which right at the heel bone here, is just cut slightly, just by a third. You cut it away from the bone, and that takes away the pull of the plantar fascia on the heel bone, which takes away the pain. Oh, I'm not done yet. Any questions so far?
Yes, we do have some questions coming in.
Okay.
So, all right. So someone wrote, I realize this applies to more than the foot. If you have a skin problem caused by an autoimmune disease, what are the effective treatments that you would prescribe?
Depends on the autoimmune disease.
So that's more doctor specific. That's more patient specific. Okay.
Yes.
That's great. What causes toe cramps?
With toe cramps, it's usually dehydration. It also could be a circulatory problem as well, especially in the toes, because you can have real strong pulses on the top of your foot, which is where we always look for your pulses. But as you get more towards your toes, the blood vessels become much thinner, so it's much easier for those to kind of clog up and not get circulation down into the toes. So it could be one of those two things.
Is your Achilles tendon part of your feet?
Depends on who you're asking. Um, but yes, it is
We're
because
asking you.
it does connect. Very good. It does connect to your heel bone, so which is part of your foot, but it is part of the foot and ankle complex because it does start in your the Achilles tendon is what connects your heel to your calf muscle. So it starts, towards the bottom of your calf muscle and then attaches to the heel.
Is ketoconazole cream effective for toe fungus?
Ketoconazole is relatively effective, but those creams don't penetrate the nail as well as they do the skin, and that's why it's more for an athlete's foot.
Does it matter if I see a foot doctor or a dermatologist for nail fungus?
No, it does not. Nope, because we're both going to prescribe one of these things I've mentioned. I've had numerous patients come in that have seen their dermatologist first and are using psychopyrox or something else or have been on the oral medications.
All right. And we have a review for you. Outstanding presentation. Thank you. I'm one of your patients and will contact you on my nail fungus, JMM.
Oh, thank you. Thank you.
Okay. I have a dropped foot. Is there any medical advances in dealing with nerve damage?
Unfortunately, not yet. Although I did see today, I had a patient today with a drop foot, and and for the drop foot, you usually wear a brace. It's called an AFO. It's a brace that goes in your shoe and prevents your foot from dropping. I had a patient today who has the brace, but it's on the outside of the shoe. It's connected to the shoe, so it doesn't take any room in the shoe because usually with that AFO you have to get a different size shoe than what you normally wear. But this was a good brace.
All right. Well, those are all the questions we've had so far.
Okay.
So please continue. Oh, wait, one more. Can a bunion come back even after bunion surgery?
Yes, it can. It takes a while, but it can come back.
Okay.
And and the recurrence rate really depends on the procedure that was done first. And that's a whole other lecture, bunions. But yeah, you really have to address the cause of the bunion and do the work of correction at the cause of the bunion.
Okay. Thank you. Those are all the questions we've had so far.
Okay. So in conclusion, with proper foot care, this is how we're going to keep your feet looking and feeling their best. Inspect your feet. Look at them. Look at them every day. And notice if there are any changes. If you notice any redness or cuts or an odor that you don't normally have. You wear proper shoe gear. Maintain good foot hygiene, meaning wash your feet, dry in between the toes. That's key. You don't want to put socks on a wet foot. At the same time, you want to keep your feet hydrated. You want to dry them, but you want to keep them hydrated as well. And you don't ignore your feet when they hurt. When your feet are hurting, they're talking to you and they're trying to tell you something, so don't ignore them. When you do cut your toenails, cut them straight across. Do not cut into the nails because you'll be in my office in that chair getting that nail cut out. You want to have regular exercise. Walking is great exercise for your feet because you want to keep your circulation going. And the more you walk, the more you exercise, you get that blood flowing and you keep that circulation getting into your toes. You don't want to wear the same pair of shoes every day. So you kind of alternate your shoes. You avoid walking barefoot, especially on hot sand or in the house or on hardwood floors. I've had countless splinters having to be taken out due to hardwood floors. And then when you do have a problem, you seek help from your podiatrist for any of these problems.